Hi, I'm Dr. Greg Ash, and I'm going to explain to you how to set up the CPAP 100 and a patient circuit and put it onto your patient. As these devices were specifically designed for use with COVID-19, the first thing you must remember is that COVID-19 is extremely infectious. So before you approach your patient, please make sure you're wearing appropriate personal protective equipment. Do not go near your patient without protecting yourself. There are no emergencies in a pandemic. You can now plug in the oxygen and air pipes into your wall supply. The oxygen is the white pipe and needs to be plugged into the labeled oxygen port on the wall. You must plug the medical air pipe, which is the black pipe, into the labeled medical air port on your hospital supply. Once you've done that, you're ready to set up the patient circuit, which you're going to put onto the patient. First of all, make sure that the device is switched off. Please set the oxygen at the level that the doctor has decided. Once you've set that, please set the number of liters that your patient requires of airflow. The things you need for the patient circuit are firstly a CPAP mask, which has got an inspiratory port, an expiratory port, and an anti-asphyxia valve. The second thing you need is a new 99.99% viral filter. The third thing you need is a 22mm anesthetic corrugated pipe. Lastly, you need a PEEP valve. Now go to your mask and connect the 22mm corrugated anesthetic tubing to the mask. On the expiratory side of the mask, you need to put a viral filter. Please make sure that this is a new viral filter, as these filters do not last forever. Once you've put the filter in place, please put a PEEP valve onto the other side of the viral filter. Now attach the other end of the corrugated anesthetic tubing to the port on the bottom of the CPAP 100 device. You're now set up and ready to put the patient circuit onto the patient. First, switch the device on and check that gas is flowing through the device and through the mask. Now apply the mask onto the patient. Make sure that the mask is fitting well and that there aren't any significant leaks of gas from around the mask, and that the patient is comfortable. Immediately look at the CPAP 100 gauge and check that the pressure that you have set on your PEEP valve is being measured accurately on the device and that you are delivering the correct pressure to your patient. Once you've done that, allow the patient to stabilize for a few minutes and then check their percentage of oxygen in their blood with a pulse oximeter. Now check a full set of observations of your patient, including respiratory rate, heart rate, and blood pressure, as you would with any critical patient. Having done that, you need to make some checks on the mask itself. Look at the PEEP valve and make sure that there's gas escaping from the PEEP valve, especially when the patient breathes out. On the side of the mask, there's another valve, and this is an emergency valve if there isn't enough gas being supplied to the patient. Make sure that the patient is not opening that valve when they breathe in. If the valve is opening, it means you are not supplying enough gas to your patient, and you need to increase the flow rate with the dial on the CPAP 100. Now that your CPAP 100 is properly set up and delivering oxygen under pressure to your patient, you must continue to monitor them 24 hours a day, because there are no alarms on the CPAP 100 which will warn you if your patient deteriorates. It is your responsibility to make sure that they are getting enough oxygen by means of a pulse oximeter and that they are not getting into respiratory distress. If the patients develop respiratory distress or low oxygen, The doctor must decide whether it can be corrected by increasing the oxygen or gas supply by the CPAP 100, or if the patient has deteriorated enough that they need to be transferred to ICU for full mechanical ventilation. Again, please never approach your patient without wearing appropriate personal protective equipment, and watch your patient carefully while they're on the CPAP 100. Thank you.